Hello, I'm Dr. Mary Orere. I'm an Assistant Director of Public Health here at Birmingham City Council, and I'd like to talk to you today about closing the gap, which is one of the priorities of our proposed physical activity strategy. This is part of the beginning of our consultation. We'd like to find out from you, we'd like to hear from you about closing the gap. So I'll just explain a bit about what it is. With regard to physical activity, we know that some people are more active than others. Some people are not nearly as active as they should be, which is typically, it's recommended you get at least half an hour of really good physical activity that makes us sort of out of breath. And some people are nowhere near that. So what we're trying to do is to understand that we close the gap. What's needed to do to close the gap between those people who are as active as they would like to be and they need to be, and those people who would like to be or who need to be more active, but at the moment, there are barriers, there are things that get in the way, and there are things that we could do to make it possible for them to be more active. So I'll tell you a bit more about that. We need to understand what stops people from being active, whether that's something in your immediate home, your local environment, something in our the way our city is designed, the way we function, right through to the activities that are available or would be of interest to you where you are at home, at work, at school, and in leisure. We also need to understand how we can spend money on things that would help more people to be active. So this is about remembering that we're trying to close the gap and bring those people who are currently inactive or not nearly active as they should be to become more active. And it's adjusting what we do to help those who are least able to be active. So you will have, in your personal experience, in your day, have come across things that you think, if this were in place, it would help people be more active. Or indeed, if something were not in place, it would remove a barrier and help people to be more active. And that's what we're trying to find out. So I'll give some specific examples. We need to find out, for example, from communities of different types, what would make a difference. And a community could be a community by age groups, it could be a community by location, it could be communities of identity, communities of experience, communities of interest. And one of the ways we could do that, for example, is to create a forum that will inform the plans for change over the next 10 years. But you might have other suggestions. We'd like to hear them. We want to reduce the gap in physical activity between people in different communities. So there's certain groups that we know would possibly need to create targeted programs for, perhaps people living with a disability or people living with a long-term condition. We might also want to do something specifically for children and young people, or for people over 65, and indeed for women and girls. But what exactly is required for these different groups will vary. That's where you come in. We'd like to hear from you. What do you think would enable people in all these various groups to be more active? And what barriers are there that we could reduce and remove so that people could be more active? We want particularly to ensure that physical activity is accessible to everyone in our society, everyone in our city. So again, for example, we could offer specialised sessions for people with autism in our leisure centres or elsewhere. You will have loads of examples from your lives, from your experience, and we'd like to hear them. So this is where you come in. Please complete the Be Heard questionnaire after this video clip and tell us. We'd like to know your ideas and thoughts about how we can help people in Birmingham be more active.